Let's talk about this now. Dr. Lisa Masterson, she specializes in obstetrics, gynecology, and infertility, and also Dr. Anita Gupta, a leader in the field of anesthesiology and pain medicine. She treats women who have the same surgery that Angelina Jolie underwent. Thank you, doctors, for joining me this evening. Good to understand that you said that you think it brings awareness, but you're also concerned and you caution people to consider at least a negative side of taking this, what you call an extreme measure.
Absolutely. I have patients in my own practice that deal with chronic pain after such surgeries, and what happens in these patients is that they have debilitating pain, they end up living with pain that can often lead to prescription drug use that, as you know, has serious consequences. By all means, I agree with her decision, but there are serious consequences related to invasive surgery that need to be understood by patients, and informed consent needs to be in place, and physicians and patients need to be fully aware that these surgeries cannot be taken lightly, and is certainly a personal decision.
I appreciate all of you joining us this evening. Dr. Gupta, to you first.
Yes.
As you're looking at the types of injuries that doctors are seeing here, what does that tell you about what happened inside of the train?
Well, you can imagine with the magnitude of a collision such as this that there's going to be tremendous injury, head injuries, rib fractures, orthopedic fractures, and what we have heard at many of the local hospitals that these are the injuries that people have had. This is what physicians train for. As an anesthesiologist, this is what emergency personnel are ready to do, first responders are ready to do to take care of individuals with these kind of injuries.
You arrived on the scene, you guys arrived on the scene early on here. So Sarah, when you out effort here, when you think of Dr. Gupta, what went on here, 7 people lost their lives here. It is, it's amazing that many people survived.
We are very fortunate in Philadelphia that we have a multitude of trauma centers. So locally, where this crash happened, Temple University, Hahnemann University Hospital, level 1 trauma centers were ready to go. Emergency response was there. We're very fortunate there wasn't much more injuries.
Well, we thank you all for joining us, and I mean, we appreciate people like you jump in and you run into danger. Thank you, Danielle. Thank you, Sarah. Thank you very much, Dr. Gupta. We're going to continue on here on
Roman
CNN.
Polanski. Quaaludes were once considered a party drug with nefarious uses, a precursor to the date rape drug. So I wanted to bring in Dr. Anita Gupta, Vice Chair of Pain Medicine and Regional Anesthesiology at Hahnemann University Hospital in Philadelphia. So, Dr. Gupta, thank you so much for joining me.
Thank you very much.
You know, just in reading about the history of Quaaludes today, this really dates back to the 70s, and it's synonymous with the disco era and sex.
Yes.
How was it supposed to make you feel?
So it's interesting, Quaaludes, also known as methaqualone, is a CNS or nervous system depressant. And what that means is that when an individual has this medication, it can drop their blood pressure, it can stop their respiratory effort, and they can actually feel a sense of dissociative amnesia. And what that means is essentially they may not be connected to reality. They won't know what's going on, and they can feel unaware of circumstances they may be in.
So does it cause you to, do you feel like you're blacking out? Are you conscious the entire time?
So this is a sedative. So if it's given, you are going to fall asleep. There's no question about that. Now, a very similar medication that's still used today, known as diazepam, or more commonly as Valium, is very similar to this, but this Quaaludes is much, much more potent and very powerful. If given even in small amounts combined with alcohol, you can see detrimental effects. People can have overdoses with that.
I want to ask Dr. Gupta this because some wonder if the procedure was even necessary, because it showed that this latest procedure showed that there was a small benign tumor on one ovary, but no signs of cancer in any of the tissues with her procedure. Was it even necessary, Dr. Gupta?
So these surgeries absolutely may be necessary in particular individuals, but when there's a benign tumor there, even the surgical procedure in itself has much controversy right now. As you may know, the laparoscopic approach to this surgery currently has significant risk related to it, and the FDA is examining the products that are being used for that procedure. And that in itself is a controversy. And in addition to that, the massive open procedure that's related to this, the recovery for that can be tremendous. And certainly those conversations need to occur before surgery. I all too often have to deal with these patients after surgery that have uncontrolled pain require extensive hospitalization, and require amounts of medications that can sometimes be astronomical.